Greetings to all the viewers. I am Dr. Pv Satyanarayana. I am a cardio-thoracic surgeon and I am operating particularly on heart surgeries for the last 40 years. And major bulk of our operation are bypass surgeries. If you look at this one, in our country, particularly in India, the heart diseases are gradually increasing in volume, and also another major concern for us here is younger age group of people are getting heart attacks more frequently than ever before. Nearly the disheartening problem about heart diseases are out of 50 million deaths in the India per year, 30% are because of cardiovascular diseases. Since 1980, the risk of coronary artery disease has increased nearly 4 times. And also, significant amount of economic burden to the society. Nearly 15,760 billion rupees were spent in the last 10 years of 2005 to 2015. Another major concern for us in India with the heart diseases, many number of people are getting heart attacks less than 40 years and even less than 30 years. That is a major concern when compared to the rest of the world. When they are getting the heart attacks, incidence is reducing in their countries, and in our country, the incidence is increasing. Not only that one, the most important productive age group of people are getting heart attacks. This is a major concern. And for the last 40 years, we are thinking how best that we can predict the heart diseases and also prevent the heart attacks. That is one of our major concerns, for which we took the help of Framingham heart risk score, and we estimated many people, and for our dissatisfaction, we could not predict in many times according to the Framingham score and the amount of heart attacks what we are getting, both of them are not correlating. That's the reason why, after working nearly about 40 years and after reading many articles from the literature, I want to suggest a different model. Here, this is the main object of this model is we should be able to predict 8 to 10 years ahead of any major heart event or major heart attack. And also, this should give a sufficient time for us to change our lifestyles and at the same time to seek for a better advice, and particularly for those people who are losing their life, nearly 30% of them who are getting heart attacks will not reach the hospital and they are dying on the way. So, if we can help those that segment, it will be much more helpful for us. And for this, as I told you, even a 30 years old or even a 40 years old person are at risk of heart disease, particularly in India. So, we have to screen the people right from the 15 years onwards so that we can identify the people who are likely to get the heart attacks in 8 to 10 years ahead of the time. So for that, we chosen the most and fundamental thing is measurements, the measurements, and that too, what we want to take it is classically before that many years we were following BMI. BMI is not a really predictor of many diseases, particularly in our country, because our frame is small, and also most of the Asians, particularly Indians, are not obese, but still, in spite of their thinness, they are getting metabolically unhealthy diseases. Even though they are thin, they are getting metabolically unhealthy diseases, for which what we are heavily depending on the central obesity, like male persons more than 40 inches, female persons 35 inches across their abdomen near the umbilical area. If they are there, they are at risk. More than that one, of late, what we recognized is waist and in the height, the ratio, if it is more than 50%. Suppose you take a height of somebody 160 centimeters and the waist around the umbilicus is around 80 centimeters. If the ratio is about 50%, then it is okay. But if anything more than 50%, even a 51% or a 52% is also is a concern, and one has to undergo tests and give importance to that even more than anything more than 50% of a waist and height ratios. And for the while taking the measurements, one has to take both the measurements in the same way. Like suppose if somebody takes in centimeters the height, they should measure the waist circumference also in the centimeters. Similarly, if the waist and in the height should be in the same scale like inches or centimeters, and if the ratio is more than 50%, one should be extra careful to do other blood tests. Similarly, in our culture, many of the times we were, particularly the female, are lucky in that one, they were given a gentle reminders because of this, the waistband, and which is made up of a gold, and it is an excellent way to monitor their waist circumference. So one has to take a gentle clues from these things, and we adopt the necessary tests which are required subsequently. Like if you look at the Dr. Ted Neyman work, he clearly demonstrated the waist and height circumference, the ratio, and also the one of the most important parameters in the metabolic syndrome, that is called a insulin resistance. There is a clear-cut good correlation between waist and in the height ratios and in the insulin resistance. Similarly, we all identified three types of personalities. One is a obese individual who is equally having a fat not only outside the body but inside the liver and also the inside the abdomen and pancreas. These are the people who are at highest risk. Whereas the people, even though when they are obese, but if they don't have the visceral fat that is inside the abdomen or in the liver or in the pancreas, like the person who is in the extreme, this one, even though he is obese, he doesn't have any visceral fat. This is a DEXA scan, which can read the amount of fat inside the body. But whereas in the middle person, he is thin, but at the same time, he has got a fat inside the liver and also visceral area and also in the pancreas. He is the most vulnerable as much as a fatty individual who has got a visceral fat. And also deceptively, this thin individual looks healthy, but he has got fat inside and he is more vulnerable. Whereas a very obese person and he doesn't have a visceral fat, in one way that is a protection, and he can postpone his blood pressure and also the diabetes and heart diseases for quite some time. It is not unusual for us to witness many people who are obese, but at the same time they are lucky enough not to get the blood pressure, not to have a diabetes, and also living happily and healthily. And many people wonder why this is happening. The reason for that one is, even though he has got very much fat, that fat is underneath the skin, but not inside the abdomen, not inside the liver. That is the one which is protecting him. Whether it's thinness or the increased higher weight is not going to decide much about the future events of the heart diseases. Similarly, like you can see, like sumo wrestlers, they are very much overweight, looks like person, and also obese. Fortunately, they don't have any kind of a fat inside their liver or in the pancreas, and they look quite healthy till they develop some sort of a fat inside the body. Similarly, the metabolic syndrome, there are 5 criteria of which any 3 are satisfied. One can call metabolic syndrome, of which most important is obesity. Again, the waist circumference is more than 40 centimeters in men. In women, 35 centimeters. Similarly, if they get blood test done, if their fasting blood glucose is more than 100, are receiving drugs to control the blood sugar. Similarly, dyslipidemia, what we call is triglyceride lipid profile in that one. If the triglycerides are more than 150, or his HDL cholesterol, which is a good cholesterol, if it is less than 40, these are all indexes of a metabolic syndrome. Any 3 of these 5 are sufficient enough to qualify metabolic syndrome. And also similarly, some external signs also, if we can observe over the body, we can detect that these people are having a metabolic syndrome. Similarly, simple like skin tags on the skin, or the pigmentation on the neck or in the face or underarms, like this kind of a places, if somebody notices a pigmentation, this also an indication that one has to undergo some blood tests and also disprove or prove whether they are having insulin resistance or not. If they are having insulin resistance, then they have to change their lifestyle and if they don't have insulin resistance, probably they can treat it different manner. And similarly, these people, if they get it abdominal ultrasound, and an ultrasound, if they found to be having a fatty liver, that is another strong index that these people are having a strong metabolic syndrome, and these are the people who are likely to develop in future 8 to 10 years later some sort of a heart disease problem too. And there is one man like Dr. Joseph Kraft. He has done extensive work on a plasma insulin, and also he detected after doing the test for more than 15,000 times, and a patterns have been evolved, and based on those patterns, plasma insulin patterns, one can predict who is likely to develop diabetes, who is likely to develop the heart disease, 8 to 10 years ahead of the disease appearance. So this is very, very useful test to predict who is going to develop which type of a disease. Similarly, these are the patterns. What we can see, the Joseph Kraft described various patterns. And similarly, there is another important investigation which was there available in the late 90s, but unfortunately it was not used, and its usage was limited, and this is called coronary calcium score. If somebody is having a calcium coronary score is 0, probably we can predict that he is unlikely to develop in a near future any kind of a major significant heart attacks or coronary artery disease mortality. But if he has got a similarly, even though he doesn't have a symptoms, if somebody has got higher score like more than 400, and those are the people who are likely to develop events in a near future. So it is better to undergo the waist measurements, waist and height ratios. Second, if they got a fasting blood sugar more than 100, they better undergo insulin assay. If the insulin assay is more than 2, then probably they have to undergo coronary calcium score. If the coronary calcium score is high, probably there are a higher risk to develop a coronary artery disease. So, whereas Framingham score, which was adopted by most of the centers, is proportionally increases the risk over a period of years. As age increases, the risk also increases. But in practice, when we applied this one, many times we could not correlate the Framingham score and in the coronary artery disease in our particular region. But whereas in a coronary artery calcium score is a better predictor, for the last few events, for the last few years, we are doing this test, and it is really helpful. And particularly irrespective of age, if the coronary artery calcium score is 0, we can tell them whether it is a 75-year-old individual or a 45-year-old individual, his likely chance of getting a cardiac event is most unlikely. At least we can say the incidence is so low, it is only 2 out of 300 people who, with this kind of a score may likely to get some kind of a event. Whereas the calcium score, irrespective of age, if it is somebody is having 1,000 at the age of 40 years, he is more likely to get. Similarly, at the age of 70, somebody gets a score 0, he is not likely to get a heart disease. Similarly, you can see this is the most important graph, where irrespective of age, those people are having a higher score more than 400. One has to undergo a more critical analysis and identify their exact situation. And this is the one test which will tell you directly anatomical markation of a coronary disease. And similarly, these are the lists, and they worked out. Many reports are available in the literature. Based on that one, we can predict nearly somebody is having 1,000 coronary artery calcium score, his chances of getting about nearly 40% are there to get a heart attack in the coming events, in about 10 years events. Similarly, the death also we can predict nearly about 10 to 12 times higher when compared to 0 score to more than 1,000 score. And this is the one man, he is a chemical engineer, not even doctor. He had done extensively about all these things like a calcium coronary score, and also reviewed extensively the literature propagating the calcium coronary score to be undertaken as a predictive model, and his study are very encouraging, and this is a exemplary. And similarly, he encouraged some of the people to picturize the Widowmaker. Is freely available on YouTube. One can go through this one. This important calcium coronary score and how they can save their life. A very well depicted Hollywood movie. Similarly, there are some limitations. Everything is not good with the coronary artery calcium score. We know that one, it cannot detect soft plaque, and also there are some radiation hazards. However, it may be low, but still there is a hazard. And also the cost, particularly in India, the cost factor, and we are all price sensitive. In that way, costs also makes a difficult proposition to undergo everybody with this test. But still, the pros and cons, if you weigh, the advantages of getting it coronary artery calcium score are much higher when compared to the negative impact about that. Similarly, if you want to predict with all the things like a coronary artery calcium, if somebody is having more than 400, if you can do the repeated test, and if there's a gradual increase of more than 20% per year, if the calcium score increasing, then they are more vulnerable. And if somebody is having a less than 20%, the progression in the coronary artery calcium is less vulnerable for heart disease. Similarly, all those people who has got a higher score should undergo the TMT test and also echo, and also required some nuclear thallium-like studies, and so that we can assess their coronary risk. And also something like a non-invasive test like carotid intima medial thickening, and if somebody is having a 0.7 millimeters in their neck vessels, the thickness of the inside the blood vessel layers, and they are also at risk, and they better undergo the further tests to confirm how far they are vulnerable to get a heart attack. And then based on that one, if you see this flow diagram, what we are doing is the body measurements in the first, and in the waist height ratio, if you measure it, somebody is having a more than 50%, then we will assess with a fasting blood sugar. If somebody is having a more than 100, and then we'll go for insulin assay. If it is more than 2, then they will go coronary calcium score, and also the score is more than 400, then they will likely to undergo TMT and thallium scan, or if required, coronary angiogram. And based on that one, we can decide whether they can be managed with medical therapy, or stenting, or bypass surgery, or simply lifestyle modification. So many times, if the scores and if the other criteria are not satisfied, by changing the lifestyle itself, they can postpone the coronary artery disease in most of the people who are vulnerable. And even if they may not be able to cure it, but at least they can postpone it. In other words, what I mean saying postponing means, suppose somebody is likely to develop at the age of 60 years coronary artery disease, he can postpone to up to 70 years. Similarly, a 70-year man is likely to get with his anatomy and physiology heart attack, he can postpone it to 80 years. So there is a big margin for us to modulate, and lifestyle modification are very, very important in this one. And in that way, the other key predictors also they helps, like LDL, HDL ratio, ApoB, ApoA ratio, height, triglyceride levels and VLDL values, small density LDL values, and lipoprotein little a. And these are all the more recent investigations many centers they are doing. If you do along with the HbA1c and also HSCRP and GGT, and many of these tests will be helpful to predict who is at risk. And most of the important things today in an informative technology world, even the apps are available, and one can download in their mobile phones, and they can assess their risk, depends upon all the various factors, and they know very in advance whether they are at risk or not. And if they are at risk, what they can do is they can change their lifestyle. Particularly, there are 7 pathways like this: diet change and smoking avoidance, and exercise, fasting, healthy gut biome, and chronic stress avoidance, and sleep disorders if any to be correcting, and yoga, meditation, spirituality, and avoidance of toxic environment. What we mean by toxic environments: polluted water, polluted air, polluted sound, polluted artificial light, and also most important these days, like electromagnetic interferences. These are also causing a lot of disturbances for our health. If you can take care of these things, one can easily postpone the disease, for which the most important, what I feel, is the low carbohydrate and high fat diet, and for which the 5 to 10% of their diet should comprise carbohydrates, healthy carbohydrates, and also the protein should not exceed more than 30%, and the rest, like 60 to 70%, they can take the fats and healthy fats, not unhealthy fats. Healthy fats are important. And if they can adopt this lifestyle with this diet modification, probably they can postpone the cardiovascular morbidity and mortality. We have done our own studies in our institution, many people got benefited. This is one of the statistical data which tells you how much they reduced their weight and how much they reduced the BMI and how much they are closer avoiding the risk factors for coronary artery disease. And similarly, in all over the world, if you look at like Stephen Finney, Eric Westman, and Jeff Olek, and Sarah Hallberg, many of these people are doing a significant work, and they have been contributing, and the benefits of the low carbohydrate and high fat, and this is one form of a keto diet, not exactly may not be keto diet, but it is a one form of a keto diet, and this is very, very helpful to change the lifestyle and to avoid the cardiovascular risk and also cardiovascular morbidity and mortality. Similarly, Jeff Olek and Stephen Finney have shown scientifically proven all the cardiovascular risk factors improved with a low carbohydrate diet, and in the bad markers reduced, like good markers like HDL and other things also significantly improved. And one need not worry so much because of the amount of saturated fats that are recommended in this diet, need not be worried because of the heart diseases. Similarly, we have got 4 types of bodies. One is insulin sensitive, other is insulin resistant. In an insulin sensitive individual, if he is slim and thin, if waist and height ratios are 50% less than that one, probably you may not get a good benefit out of this one. Probably you don't require that one. But whereas overweight person, he will be benefited, but not as much as the insulin resistant and slim people or overweight people. But most important, people who are going to benefit are insulin resistant with overweight people, and next extent is slim people, because they don't even recognize that there is a disease in them, and these are the people who maximum get benefited out of this one. So much of information these days is available in the internet and information magazines and literature, and we are getting confused what type of diet to use and also what type of precautions to be taken. And I know that this is one of the advices what I can give, and so that you can judge yourself, depends upon how much you are informed, how much valuable assessment you can make out of this one, and then get benefit out of this one. If you don't read newspapers, you are uninformed. If you read newspapers, you are misinformed, said by Mark Twain, and it is our judgment, our wisdom to decide about that one. And in summary, to summarize that one, insulin assay and coronary artery calcium score are the most useful parameters which will help us for those people who are abnormally ratio, particularly the waist and the height more than 50%. If they are there, they better undergo the insulin assay and coronary artery calcium score, and they are the people who are going to get maximum benefit out of this one. And for which to change the lifestyle modification, low carbohydrate and high fat diet is one of the good diets that are recommended to control or postpone or to prevent the coronary artery disease. Thank you very much for your patient listening.